Should you get a nose job? Have you ever wondered why other people do? We're going to talk about common reasons that people bring up when it comes to changing the appearance of their nose. My name is Dr. Peter Vila. I'm a facial plastic surgeon. So you might be wondering, why do people get nose jobs? What is it that they don't like about their nose? And there are a few things that kind of come up over and over and over again that I'll share with you because I think it's helpful to know what other people are saying. So we're gonna break the nose down into subunits. We're gonna teach you a little bit about anatomy today. So the top of the nose, this flat part of your nose, is called the dorsum. And the dorsum is definitely an issue for a lot of girls. For guys, you can have a little bit of a bump here and it actually looks okay. It looks pretty good. It looks masculine. For a girl, oftentimes they get their dad's nose and they have a bump there and then it doesn't look as good and it's just not a feminine trait. Now, some people really like the bumps on their noses. They think it's part of them. It might be part of the ethnicity that you identify with, and some people don't want to change that. And that's totally cool. I would never tell you that you have to have surgery. And so that's just one reason that some people are often bothered by is the bump. And so taking that down is a pretty common reason for a cosmetic rhinoplasty. Moving further down the nose is the tip. And so the nasal tip is made up of the lower lateral cartilages. And it looks that way because of the shape of those cartilages. Now, there's different reasons why people might want to change the way their tip looks. In some people, the nose is very droopy. And something that often people say is that when you smile, the tip comes down a little bit, okay? And the reason that happens is there's actually a muscle here between your upper lip and your nose. And when you smile, it activates that muscle and pulls down this part of your nose, or the columella. What that does is it can make the tip come down. So if you're smiling in a photo, the tip comes down and then your sort of droopy nose turns into an even more droopy nose. Now, a lot of people don't like that and they want to have surgery to correct that. So what can you do about that? You can make the tip more perky. And so this angle is a very important angle that people talk about. That's called the nasolabial angle. And in guys, it should be around 90 degrees. And in girls, really, it looks better to have a little more of an angle or a little perkier nose than in guys. So we often look at it from the side and we will calculate that angle. Now, it's different for everybody, and the trend these days is to have a very cute, perky nose. So absolutely, the tip is very important, and that's something that a lot of people would like to address. Another common complaint about the tip is that it's too broad or too boxy. So again, what that comes down to is the shape that your cartilages are making under the nose. A tent is the shape that it is because of the rods underneath that give it that shape. So just like your nose, if you're gonna change the shape of the tip, you have to change the shape of the cartilages underneath. So that requires surgery. What that does is that we can then change the shape and make it more pointy or lift it up a little bit. And there's different things we can do in the operating room to give you the aesthetic that you're looking for. But oftentimes having a nice, well-defined tip that's not overly boxy or bulbous is a nice aesthetic tip. Another reason is that if your nostrils are very asymmetric. Now, I will tell you, it is very, very difficult to get the nostrils perfectly symmetric, and most people are not gonna notice that. So if that's the main thing that's driving your decision to get surgery is because your nostrils are asymmetric, it's important to look at why that is. If you have a very deviated septum, meaning the cartilage that divides the two sides of your nose, if that's way over to one side, sometimes that can pull the nose over and make the nostrils look asymmetric. But sometimes that's really hard to fix, and I would never promise anybody that we're gonna get those perfectly symmetric, but we are gonna get them better with surgery, and that should always be the goal, is to get things more symmetric and better, not perfect. Another thing is that if the nose is just coming too far off the face, where the projection or this distance from your face to the end of your nose is too big, sometimes we can take that back. And a lot of that has to do with the overall harmony of your face, meaning how big of a chin do you have? Are your cheeks in the right position? Is your nose in proportion with the rest of your face? All of these things need to be taken together. And when you look at the overall facial harmony, that's when we can sort of decide what the best distance would be for your nose. Another common reason people get surgery is because of the alar base being too wide, or basically the nostrils are just too wide and your nose looks smushed. Now, When people have surgery to correct that, the incisions are back here, and what that does is that it brings in the nose so that it's not so wide, but rather a little more pinched. Another common reason that people bring up is that they don't have a strong dorsum, or they feel that the nose is too flat. And this is something that's a little more common in Asians and African Americans, but they feel that the radix is too shallow, this distance here, and that the dorsum of the nose just doesn't come out as far as they would like. So we can bring that out and build out the nose in what I would call an augmentation rhinoplasty, and we're using either rib cartilage or cadaver cartilage to layer in that material and build out the nose. And finally, another reason, unfortunately, that people get surgery is because they had a first nose job and they're not happy with it. So that's what's called a revision nose job, or revision rhinoplasty, because they either don't like how their nose looks or they can't breathe through their nose after surgery and they want to correct that. Those can be a little more complex because it comes down to the way things healed and how things were set up. And so there's not really a sort of one size fits all for that. They're often very different issues, sometimes pretty complex, where oftentimes we're talking about taking rib cartilage to rebuild the nose, essentially. At the end of the day, you're the only one that has to go through the surgery if you decide to have surgery. So it's helpful to get opinions from other people, but it really comes down to you, and it's a personal decision as to whether or not you want to do that. Again, I always suggest that you find somebody that you trust and have a good relationship with. You can have fun with it. It doesn't need to be a scary thing. It doesn't need to be a serious thing. Yes, there are risks. Yes, it's real surgery, but you can have fun with your surgeon. If you're into the video and you like this content, go ahead and like the video. You can subscribe to my channel on YouTube or follow me on Instagram. And I will see you guys on the next video.